learned about BodyWorks through a nutritionist who worked for the YMCA as I was searching for fitness and nutrition classes for both my daughter and I.
I would say the amount of time that you should take before starting to recruit parents for the program would be about a month or two. I think anything before that they kind of would forget about it, but you want to give them ample time and yourself ample time to let them know about the program, and then usually 2 weeks before the class starts, I'll send out a mailing or I'll make phone calls to my parents to remind them about the class starting.
If I started long before, like 2 months, I may lose some of them. They may get engaged in other activities. And if I do it too soon, I may not have enough time to recruit enough participants.
Once you figured out what your target audience is, it's really important to find out where do they frequent. Is it their local church? Is it the local health department? Is it the local WIC office where they're going already? And really try as much as possible to tie into the personnel within those offices to help promote your program.
One of the big helpers to recruit families are health providers in the community. I like to meet with them to explain the program because they need somebody to help them to fight the obesity epidemic. They usually refer the families to us.
One of the obstacles that we found in our recruitment was, at first, the people in the community thought that the program was a research study, whereas BodyWorks is not about research at all. It's more about prevention and families learning about healthy lifestyles, physical activity, and nutrition. And so we had to really do a little bit of education as we recruited.
They have so much to do, and they have so many other priorities that they don't see nutrition and learning how to eat healthy as a priority in their life. And then we have to work with that first.
To get them to understand that it's going to make some changes in their life, and they're going to really have to adjust their whole family lifestyle, not just their child.
What we used as part of our program for incentives and excitement around coming back to the programs were what we called cues to action. So we thought we're really wanting to encourage physical activity, but we also wanting to encourage the mother-daughter, mother-son, or caregiver-adolescent relationships. So let's find things that they can go and do together, such as going bowling. That way they stay active together.
The incentives that I would suggest are things related to health and nutrition. Jump ropes, things for little kids to play with in the yard, balls, hula hoops, sidewalk chalk, anything that would get families outside and playing together.
We have advertised in a number of different ways. I've given interviews to newspapers, and that's been very successful. We have the local papers, and then we have the Seattle Times, and we've been able to advertise in both of those. We also have posters throughout the hospital, and we have flyers that I have in doctors' offices. We've dropped off flyers at schools. And when there are community events, I'll go and sit at a table and give my flyers out and talk to people about what it is. And so little by little, I've been getting the word out about BodyWorks.
We're actually very fortunate that we have a partnership with our local news station, and we actually went on the news show one week and promoted the BodyWorks class, showed the toolkit and talked about the class.
In our community, what we used were all the avenues within the local offices where we recruited. Most of them have newsletters that go out to the participants every month that participate in their programs. In the churches, they have church bulletins where they were able to include the recruitment flyers, part of that. In our local WIC offices, they have little folders where they get for their vouchers, so we were able to put them in that. So I think it's always a challenge to be able to think ahead how to over-recruit so that on the initial day or once people actually start coming to the program, you have kind of the number that you had in mind initially.
You need a lot of time to do it. So I've had a lot of help. I have my office manager, I have my staff in my office who talk about BodyWorks all the time. We have the posters, we have advertisements, and word of mouth is really the best way.
And the best advice that I can give a new trainer trying to promote the program is to find out what resources are in their community. Where is their health department, their schools, who they need to talk to, making those relationships and those connections with people in their community, because those are the people that are going to have access to the families that are in need.
And utilize all of the BodyWorks trainers around the country who are actively involved in BodyWorks and are ready to give advice.
Exhaust all possible avenues for recruitment. In our program, what we found was when you initially start and find a target audience, you want to just hit the sites that you commonly think they would be going to, but the more you can put out there, the greater the chance that you'll have a larger response.
For more information about BodyWorks, please visit womenshealth.gov/bodyworks, or you can contact the BodyWorks Help Desk at bodyworks@hhs.gov.